Welcome Ramesh. We are so happy to have you today morning with us. So Ramesh is going to be the speaker at AKC today, but before that I thought let us grill a little bit of knowledge. So Ramesh is MD of India, a cardiologist and an entrepreneur, turned venture capitalist with a passion to be part of India's healthcare innovation story. Ramesh, amazing. And create business that positively impact lives. So you have been an inspiration, Ramesh. Thank you very much. And few things which actually what we did is our AKC club members, they had their inquisitiveness to know you more. So these are the questions bounced out of them. The first thing which they want to learn from you is that you have transitioned from being a cardiologist to a venture capitalist. What inspired you to make this bold shift? And how has your medical background influenced your investment strategies?
That's an interesting question, Girish. What happens is, as a doctor, especially if you're a specialist, you do MBBS and then you do MD, general medicine, and then you become a cardiologist, and then you become intervention cardiologist. You become very little monotonous actually. So you don't see the range of patients as you go further. As a cardiologist, you only see heart patients. As an intervention cardiologist, you only do angiograms every day, do angioplasties. I think my mind is a little curious mind. Probably it has the component of both the left and the right brain. On one side the science, the other side the entrepreneurship, want to be part of new ideas. So as a cardiologist, I thought probably I can see 50 patients a day and 100 patients a day. As an investor, can I invest in new companies which can change the world, a new device which is not there in the market, a new drug which is not available in the market. I think that made me switch a decade and a half ago.
So it's a passion behind the whole thing, and I would say that in true sense, business is generally called heartless. As a cardiologist, you are truly getting the heart sense into your business. Amazing. Your work with companies like Sigtuple and Kakinos Healthcare, they are revolutionizing diagnostic and oncology care. What do you think about the role of AI and tech in this field?
So I think AI probably 5 years back or 3 years back, today is totally different actually. I think today Gen AI, probably I think it will transform most of the industries. That applies to healthcare also. There are certain easier things in healthcare where AI will take a role. There are certain things which are more long term. The easier things will be simple things like AI in hospital operations are far more easy, like billing for example, or interpreting the doctor patient notes and giving insights, or preparing a report for the doctor to send to the patient or the referral doctor. Those are the easier ones. The next level ones would be using imaging and then AI. That's where Sigtuple comes in. This is a digital pathology company, and where images are there in medicine like radiology, like pathology, like dermatology, AI probably will have a very significant role. It won't replace doctors, but it will aid doctors. Yeah. So a doctor with AI will be far more superior when compared to AI alone or doctor alone. So wherever the images are there, I think that will be probably transform the next 12 months itself or a couple of years from now. But in the long term, drug discovery, that's where everyone is betting onto it. Already recently there was, you can predict the protein, the 3D modeling of the protein also based upon the available information, which would have taken years together. Now you can predict how the protein folds itself, how it interacts with the cells and all that. So I think AI, like in any other industry, whether it's agri-tech or fintech, healthcare, there will be tremendous impact on it.
So, of the question what I have received, my personal inquisitiveness is going like medical science has definitely progressed even without AI, and the average lifespan has gone up for humans. With the intervention of AI and whatever you explained, like we are now cutting the layers and going deeper into the analysis and then giving the diagnostics. Do you think this will enhance the lifespan, and to what extent?
That's a difficult question, prolonging the life. it will definitely improve the quality of life. For example, if you take 1947 independence, probably our lifespan is around 30 years, India average lifespan. Now it already reached 70 years.
Yes.
So this from 30 to the last 75 years, the lifespan has increased by 40 years actually. And if you see really, the real impact, what really prolongs the life is not great discoveries actually. It's simple hand washing, it is simple hygiene, drainage systems, clean water. Those we underestimate actually. Those made the maximum impact. Obviously, the smaller impact will be the identification of antibiotics 40, 50 years back. So incrementally lifespan may not dramatically increase, but definitely the quality of life, I think that's what we should look for, I think.
So what happens is, this is my understanding, that when your body is ailing and suffering, your body continuously keeps releasing those toxins, and most of these toxins are also poisonous. So my take is that when the right medical intervention goes, they have their own side effects, but if you weigh both of them, the side effects of this medical thing is way less than the toxins which are released out of suffering.
Yeah.
Is that the right analogy to put across?
Probably I'd use a different context, something like a personalized medicine. Maybe, probably I think you're referring to that. For example, someone is a hypertensive patient or a diabetic patient. Right now, we are using the same drugs for everyone, whether it's an American, whether it's a Japanese guy or Indian, South Indian, North Indian, or different geographies or ethnic groups. But the drug they may work in each person is totally different. We don't have the information today. Okay. So tomorrow, probably once genomics profiling becomes far more common, then we know which drug will suit me, which drug will not suit me. So this personalized medicine, which is more dependent upon the genomic analysis, we are nowhere close to that now. Maybe 5 years down the line, 10 years down the line, 15 years down the line, the kind of food, each person reacts differently. Correct. Similarly, the medicines also. I think probably maybe a decade or 2 decades from now, probably you can always argue the AI also will come in there. It's not just the sequencing of the genome. How do you interpret the genome? Genome is gigabytes of data. How do you interpret it? You need Gen AI applications on top of the genomic raw data to give the output to the physician or to the patient. So I think it's very interesting times. The data you get from the wearables, your genomics data, and then your medical data, layer on top of it your AI applications, then you have the personalized medicine. But that will be at least a decade or two in the making.
Definitely all this requires all those patience, gestation period, and money.
Yes.
So you were behind the scene now, and you're on the scene supporting the cause. Yes. With getting the VC angle to it, and see that it sees the light at the end of the tunnel.
Hopefully.
Well, you have backed startups like SugarFit and EI System that focus on chronic disease management and stem cell therapy. What do you look for healthcare innovation startup, and what advice would you give budding entrepreneurs in this space?
Both of them are different. SugarFit is for management of diabetes. Diabetes is one of the 4 non-communicable diseases which India is going through, and almost like an epidemic: cardiovascular, cancers, respiratory, and diabetes. There are 175 million diabetics in this country, 175 million. And half of them may not know that they are diabetic actually. Oh, really? So the SugarFit is basically a technology-enabled counseling service. We take the CGM data, continuous glucose monitoring data, and then we analyze the patient first 2 weeks or 4 weeks, what he's eating, what kind of exercise he's doing, and how it's reflecting in the blood sugars. And then AI will help the counselors in guiding those patients. So basically something like a nudge. They keep on nudging the patient, do this, don't do this, and the significant drop in the blood sugars, significant drop in the weight, significant drop in the hemoglobin AIC. Whereas iStem is totally different. iStem is using stem cells to find treatment for diseases where there is no treatment available in the world. For example, the first condition we are treating is a condition called age-related macular degeneration. As people age 60 years, 70 years, 80 years, there will be central blindness. They can't see the center part of that. They can only see the periphery. And to an extent, once it keeps spreading, they can't even do the day-to-day. They can't even walk around because they can only see in the periphery, the entire center. They can't drive. They can't even go to the bathroom. And again, 100 million, 150 million people on this earth have the disease. There is no treatment available anywhere in the world, including the US, the Europe. So this is almost like a drug, probably far more than a drug. So you have to cultivate those cells in the petri dishes, and then you have to prove those cells or RPE cells, retinal pigment epithelial cells. That's not enough. Before you even bring it to the humans, you have to do the safety, toxicity, tumorigenicity. So we have to put those into eye of the small rats and then prove it is safe. There is no toxicity, efficacious, and tumorigenicity. What happens? These stem cells are immature cells. They can become rogue cells and become cancer cells. So I have to prove in the animals by putting these stem cells into the retina, back of the eye, it's not producing cancers. I have to repeat this experiment in small animals, multiple doses, wait for 1 year, take the same experiment to large animals, non-human primates we call, and then again repeat the study. And once the study, all the information is there, we go to the drug authorities. If the USA is called FDA, if in India is called CDCSO. And once they review the data, they give permission. And we have started doing the clinical trials, in the human clinical trials. We started probably the best 3 hospitals in the country, L.V. Prasad Eye Institute from Hyderabad, All India Institute of Medical Sciences from Delhi. The initial results are good, and hopefully we'll find a cure for a disease which no one in the entire world has done that. So it's made in India for the globe. I think one of my ambitions will be fulfilled if this drug becomes successful.
Fantastic. Wish you all the best, and we pray for the same. But in the same space, so these are your own initiatives or the initiatives you have supported?
These are not my initiatives. These are, at the end of the day, we are facilitators. We identify bright startups, and it's their idea, but we put money, we support them in multiple.
So I repeat the thing again. So somebody who is giving the backup has seen this world. So it makes all the difference. So otherwise people are only worried in the business world about the return on investment.
In fact, companies like this, especially iStem, if 100 venture capitalists see, in India at least, 100 of them will say no, because neither they understand the science, and also it's definitely a risky bet. It's all or none phenomenon. Either we succeed or we don't succeed. But the platform is there. We can still develop, but it takes a long time. It takes 10 years. So you have to sow a seed and wait for 10 years for like your palm tree or so only after 10 years you know whether the tree is bearing the fruits or not.
This requires a lot of gestation and patience, and obviously the fuel which you provide. So any tips or any advice to the startups who are into this field, aspiring to do something different, to change the world, but at the same time make good for themselves?
There are 2 types. Some of the initiatives or ideas or problem statements can be started by even young people. It's more on the digital health, for example, like Sugarfit, for example. They are into probably late 20s, early 20s, people from the IT background, consumer background. They can find a problem and a solution. But the company, if you have to solve a deep problem like iStem, the mindset is different. These entrepreneurs are 40 years, 50 years. They have worked in the industry for 10 years, 20 years. You can't expect a 20-year-old boy or a 30-year-old boy to solve some of these. So we see the dichotomy. The entrepreneurs who work on the digital health are more younger, more from the IT background, more from a tech background, whereas the deep science, they have to have the domain. You can't expect a non-science background to solve a genuine science problem. They can still, but it's challenging. Yeah.
All right. And you're always there to mentor the whole thing. Thank you so much, Dr. Ramesh. I wish you all the best for yourself, for the mankind, and thank you so much for being here. I look forward to further more interactions with you and being part of your organization.
No, thanks, Girish, you and Shruti Ajal, fabulous initiative. All the best for your future
Thank you so
initiative.
much.